Hi, everyone. My name is Amy Greminger, and I am clinical faculty at the medical school. And today I'm very excited to talk to Ian McLoone. Ian, can you introduce yourself and what role you have on the interprofessional team?
Sure. Yeah. My name is Ian McLoone. I am a licensed professional clinical counselor and a licensed alcohol and drug counselor. My role is as a therapist and supervisor, and I recently co-founded a new clinic with a couple colleagues of mine. And I also teach as community faculty in the Integrated Behavioral Health Master's Program.
Excellent. And for those of us who are less familiar with integrative behavioral health, can you tell us a little bit about what that is?
Yeah, it's really just the integration of two fields of practice that historically have been siloed from one another, the work around addiction and addiction treatment and mental health therapy and counseling. And so the IBH program recognizes that that distinction is meaningless and has probably held us back in the field. And so it's truly integrating both mental health and substance use problems and training to clinicians who want to work with both.
Thank you so much for that. That was so helpful. Can you tell us who may not know a little bit about what a typical day looks like for you?
Yeah, I mean, my typical day looks like a lot of individual psychotherapy. I tend to be meeting with adults, individuals who have both a mental health concern like depression, anxiety, ADHD, trauma, and a problematic relationship with substances. And so we will design kind of a treatment plan together. We'll identify the goals that we want to work on, and then over time, we work together to help achieve those goals. Some folks in my field who have a similar credential will work in the context of an addiction treatment program where they might be facilitating more groups in addition to working with individuals. And then another really fun and interesting part of my day is supervising other clinicians and working together to help develop person-centered treatment plans that the people we work with can feel a part of and proud of and excited and supported in their efforts to achieve recovery.
Oh, that sounds certainly like really important work. And I'm imagining in that work, you work interprofessionally a lot. And so, can you tell us a little bit about the kinds of interprofessional connections you might have in your career?
Yeah, absolutely. So while I might be focused a lot on psychotherapy and the work of the individual, some of my social work colleagues might be more focused on identifying areas in the system where our clients can benefit from, whether it's supportive housing or benefits and other resources. So we work a lot with social workers. We work a lot with medical doctors and nurse practitioners who might be prescribing various medications and maybe directing some of the broad strokes of the treatment plan. Of course, nursing staff to coordinate care and ensure that the people that we are seeing have all of the resources at their disposal to be successful in the implementation of their treatment plan. And then we might work or collaborate with various other healthcare professionals, because a lot of the folks that we work with might be involved in various forms of care. And so being able to coordinate with, the sober house managers or representatives of different programs is a really important element of our work. And so building connections and making sure that we are working on the same team is just a really part of that process.
Excellent. Thank you so much for that. So when we think about this interprofessional work, which I know you're really engaged in, what kinds of skills are important to have as you prepare to engage in that kind of work? And how did you learn to acquire those skills?
Probably the skill that has helped me the most and maybe has helped me bridge the gap between my field and other fields is curiosity, right? Being curious, asking questions, having an authentic interest and desire to understand the way that our colleagues are thinking has really been helpful. And I've been just really struck by the kind of unending willingness and desire to mentor and to help guide that has been shown to me when I have approached a situation or a colleague with authentic curiosity. And so that's often one of the qualities that I look for in whether it's trainees or interns or just colleagues in general, right? None of us has all of the answers, and we can often do a lot of good just by maintaining that stance of curiosity and then being willing to ask questions.
How has interprofessional work impacted your career? Well, I want to say thank you. I enjoyed talking with you and learning from you so much. You provided us with such helpful insights, and I really appreciate your time.
Thank you. Happy to be here. Thanks for having me.